It's really an exciting time in the mycology world and in the microbiome world. And you guys have been really at the forefront of this. I think some of the work that you've been doing where you're looking at how the fungi are interacting with the bacteriome, so the microbiome and the bacteriome are working together under normal conditions, one-on-one or one with many. Tell us a little bit about that. It's exciting stuff.
I really agree with you. It's very exciting because, as you know, with the Human Microbiome Project, we are starting to look now at microbiology in different ways. But so far, a lot of the studies have focused on the bacteria. What's so unique about us in the Department of Dermatology and in our Center for Medical Mycology is we also looked at the fungi. And to our surprise, and not really too much of a surprise because we predicted this based on the fact that if somebody takes an antibiotics, guess what happens? They start to develop fungal infection.
Sure.
So with that in mind, we started looking at the fungi, and to our delight, recent studies from our group is starting to show that the human microbiome is not limited only to the bacteria. It should include fungi as well as viruses as well. And more importantly, we found in our studies that the fungi and the bacterial communities have developed evolutionarily so that they can cooperate, forming a biofilm affecting a number of diseases, which could be superficial, like in the case of wound infection, as well as in Crohn's disease, as our paper showed. So.
And even in atopic dermatitis and psoriasis, you have some data that shows that there's certain combinations of bacteria and fungi that go together when the skin is a little bit altered. You know, that in psoriasis or atopic dermatitis, it's different than in normal skin.
Absolutely, absolutely. That's the situation, and that's why I'm saying really this cooperation between fungi and bacteria extends beyond the one disease, for example. And from as you rightly mentioned, in psoriasis, we are seeing that fungi and bacteria like Alternaria as well as MRSA, they are cooperating together, and what the result for that cooperation is they protected themselves, as I mentioned, but at the same time they aggravate the immune response of the patient.
Right.
So it's really these organisms, they play together in a sandbox in a very unique way, and exciting to know where this research will lead us.
And of course, the ones that are playing in the sandbox don't want anybody else in the sandbox making antibacterials and things that keep the others out.
Exactly. What they do really, they are very clever, these microorganisms. Bacteria and fungi, they come work together and they form a biofilm which allow the fungi to have more virulence factors, whereas the bacteria become tolerant to antibiotics. So in a way, they're living under the fungal umbrella safely, while unfortunately impacting our patient.
Thank you.
Thank you very much.